Well, good afternoon, everyone. Today's our briefing for May 20th, and Kelly Colopy, our health director, is also joining us. Of course, she will have a lot of information to be able to share or answer any questions. We, of course, are kind of like just moving very quickly to the June 15th date. And for us here in the state of California, that's a very, very big date for us. It's when we move away from the tiered system. It's when the masking rules dramatically change for us. And it's going to be a really important date for us to kind of look back kind of on the progress we've made and really kind of starts a new chapter for us here in the city of Long Beach and across the state. Want to just start by making some broader data points and talk about a few things. So I think most folks know that as of today, we have 98% of those 65 plus have been vaccinated. Really great number. We're a little over 62% of the 16 and over category that have been vaccinated, which is great. We have our goal right now is to get that 62 to 65 next week, and then from that 65 to 70. Getting to that 70 is right now the goal. So we're taking it in chunks at a time. We want to get to 65, and then we've got to get to 70, and that's when you've really made that impact. And I think the president has talked about how important for the country and communities to get to 70%, and so that's right now where we're headed. We have unfortunately lost 935 residents to the pandemic, and I want to thank the Long Beach City Council for unanimously approving a COVID-19 memorial, which is going to be built in our city, a really important place that will hopefully center families, health heroes, and folks that have been impacted, especially those that have lost family members or friends. And that process will begin in the next couple of months. And I imagine over the next year, there will be a very engaged discussion about where the memorial should be, what it should look like, and what it should represent. We currently have 16 Long Beach residents that are hospitalized with COVID-19. That's obviously dramatically down from where we've been over the last few months. Want to also just share that we're also really one of the benefits of what's happened through this kind of tragic time is right now we're really focused on building health infrastructure with the city and kind of maintaining it as we move forward. You've probably read or been reported in the media that Community Hospital, that the ER has reopened. In fact, I was just chatting with one of the leadership there about when their first patient kind of walked into the ER, and they of course now will be soon taking paramedic calls and others. So that hospital reopening and the ER reopening is an enormous health milestone for us as a city. We're just very grateful to the entire MWN team, the nurses, the team. I had a chance to visit, and I had a chance to talk to actually a lot of the nurses that were there, and they're just so excited to be kind of reopening this hospital and being kind of at the ground floor of public health. And that hospital is going to represent a new approach to public health where you're going to have a hospital, you're going to have an ER. They're going to really focus on treating folks that are having severe complications around their mental health and mental illness. And they're going to provide, the campus and provide some really exciting announcements in the weeks ahead. So Community Hospital is a huge addition for us. In addition to that, the health department itself, we are right now having conversations about kind of maintaining this kind of increased capacity that we have. We think that when this pandemic is behind us, we'll have added an additional approximately 100 staff members within the public health space, which is really significant for a health department. So we want to ensure that the health department moving forward is prepared for the next pandemic or the next major incident. And so that additional amount of staff is going to be really important. And of course, our health director, Kelly Colopy, will be leading that team. And so how we build this health infrastructure in the city moving forward, I think is a really important question for the community. And I think Community Hospital is a part of that. Our increased health department staff is a part of that, continuing to build these stronger relationships with Memorial and St. Mary and St. Mary's and all of our regional clinics. We've built something out of this tragic time right now that's really, really, I think, powerful and that's met the health moment and that is going to hopefully remain in place moving forward. Want to talk a little bit about our vaccines and vaccine doses. Our vaccination distribution program is administered, over 330,000 vaccines. We've been doing 12 to 15-year-olds, which has been really great to see at our sites. And we've been encouraged, obviously, we have seen a doubling of vaccinations from just about a week plus ago, and that's really attributed to, of course, seeing the younger teenagers, but also the incentives that we've had in. So we've done about 5,700 plus aquarium tickets. We're giving away Nintendo Switches now every day and hotel stays. And you're going to see more of that in the future. And so there will be other types of incentives that we'll do. I'm a kind of everything on the table person. I think we should just try whatever we can to get more people vaccinated. Want to also just note that we're expanding kind of our vaccination clinic process as well. We have mobile vaccination clinics right now. And by the way, and we're going out consistently doing kind of one-on-one vaccinations. There's some really powerful stories of, folks that are homebound and that cannot go to a clinic. And we've connected with them, and we have our team to go to their apartment or to their home and provide them with the vaccine. In fact, I received a few letters and notes from people that are just so appreciative of our vaccination team at the health department for the work that they're doing there. Right now, our mobile clinics are being offered at parks 6 days a week. We have these health department outreach teams that are multilingual that are going out. We're beginning this major door knocking process. And we've given out thousands of doses through these mobile clinics. We've done about 1,600 at Cabrillo High School, 1,400 at Houghton Park, 1,200 at MacArthur. And these, of course, are small clinics we're doing where we're just getting folks that come up and get vaccinated the day of. These kids, of course, these clinics are operating 2 days a week, each one at 3 city parks. So Admiral Kidd is Mondays and Thursdays, MacArthur is Tuesdays and Fridays, and Houghton is Wednesdays and Saturdays. And we have a lot of information out about when those are. And most importantly, our community partners know when those are. So they're out there, kind of bringing people in. We are also at some Long Beach Unified Schools. We opened up the Cabrillo on Saturdays, which has been great. We're also now at Grant Elementary School and at Washington Middle School, and more schools will be added as well. Beyond that, we are looking at shifting some of these vaccination clinics. We're looking at creating some more permanency around some of these clinics so that we have some sites that are more permanent out in the community versus just on certain days. So we're talking about 90813 as a critical zip code where we can have a permanent site. We're talking about a night clinic as well, and looking at being able to provide vaccinations similar to what we have at the convention center, but maybe something in a different location that provides a lot of services for night vaccinations. We're hearing that a lot in the community is for folks that work throughout the day. We capture those people as we're continuing to reach more and more folks. And then the last thing I just want to add is that there's a lot of questions about masking. I think Kelly's going to talk about that. Just continue to stay safe. Don't feel bad if you want to continue to wear your mask out. By the way, I think that's really important. I continue to wear my mask. That's how I feel comfortable, and in certain instances. And if that's how you feel as well, you should continue to feel safe and comfortable doing that. And we'll get a lot more kind of information about masking in the future. I think Kelly is going to talk about that some as well. And so with that, I'm going to turn this over to Kelly Colopy, who will be giving over more of an update.
Thank you, Mayor. As the Mayor mentioned, we're offering vaccine clinics throughout the community. More than 10 opportunities each week in parks, schools, other public sites, homeless shelters and encampments, and at people's homes. To date, we have visited more than 46 facilities, visited 313 private residences, held 25 community clinics, 30 parks clinics, and 5 school clinics to be able to reach out to our student population. And we continue to expand those opportunities. We really are everywhere. We also have a city outreach team and many partners who share information about the opportunities in Spanish, Tagalog, and Khmer, and they visit each area within 2 days of the site to encourage people to be vaccinated. They stand at businesses, restaurants, they're in various neighborhoods, they're at park sites, sharing information with flyers, having conversations, and really encouraging people to come. As the mayor discussed, we're working very hard to overcome vaccine hesitancy, to be in more locations, to create evening vaccine opportunities, and to really continue to push our numbers up. So today I also want to talk about the face covering guidance, which the mayor mentioned. I know it's been a point of confusion, and there is also, there's just some anxiety about that as well as reopening. So the CDC did announce in the last week or so that the different new mask guidance for fully vaccinated individuals. But our current state protocols from the California Department of Public Health continues to advise that well-fitted face coverings should be worn in crowded indoor or outdoor public settings, regardless of vaccination status. Until that state health order changes, our city's health order will remain in place. You can find that health order at our website, longbeach.gov/COVID-19. When you wear a face covering, you're protecting others as well as yourself. Face coverings as well as distancing are one of the most effective ways to protect yourself and others from COVID-19. COVID-19 continues to spread, as we know, mainly from person to person through respiratory droplets. These travel in the air when you're talking, sneezing, coughing, singing, shouting, all the things some people when they're not feeling well, other things that really people think are fun, a lot of the singing, musicians, and those kinds of things. These droplets can land in the mouths or noses of people who are near you, and they may breathe them in. So the data from the published studies demonstrate that mask wearing really does reduce infection. It reduces the sharing of the virus, which continues to be important for people who have symptoms, but it hasn't shown up yet, right? Or if you're asymptomatic, there are many people who do get COVID who haven't had any symptoms, and they can infect others around them who have not been vaccinated. Masks also protect the wearer as they keep the droplets from coming to you. Currently, face coverings are still required for everyone at large events, public transportation, retail, and business establishments. Cal OSHA continues to require them for workplaces in addition to distancing requirements. Masks are also still required for all unvaccinated people outdoors anytime physical distancing cannot be maintained. They're not required for fully vaccinated people in outdoors unless you're in a crowded space. If you're in indoor-outdoor visits in private settings with other fully vaccinated people, or if you're in indoor-outdoor visits with unvaccinated people from a single household who are also at low risk for severe COVID-19 disease. We anticipate that on June 15th, fully vaccinated people will no longer need to wear a mask or physically distance themselves in most indoor settings, except where required by local businesses and workplace guidance. This does not apply to healthcare settings and some congregate settings. While we're less than a month away from this June 15th, it's important that we collectively stay the course, adhering to the current mask guidelines and keeping everyone safe. For many, the reopening and the relaxing of the protocols is welcome. They're hurrying out to engage and to be at restaurants and events and to really take on life as it was previous to COVID. But for others, there is anxiety about being in public and being in large crowds. We've been so focused on keeping our distance and staying away, and the script is relaxing, and for some, it's relaxing too quickly. In February 2021 survey from the American Psychological Association found that Americans are hesitant about our future. Nearly half say they feel uneasy about adjusting to in-person interaction once the pandemic ends. And adults who received a COVID-19 vaccine were just as likely to say this as someone who has not been vaccinated. Reopening anxiety shows up differently for different people, but it can look like stress and uncertainty about the future, fears about how to adapt to the new changes, like being exposed to situations where you may feel unsafe, or reluctant to engage in pre-pandemic activities where you found more security or comfort actually at home and in your more lockdown life. Some of the less healthy pandemic coping options we hear so much about have including a lot of people talking about their weight gain and eating too much. You've seen significantly increased sales at liquor stores and wine spaces and others because people have been drinking more. People are exercising less. They're not creating the kinds of schedules that they have wanted in the past. They're overthinking and they're fearing the unknown. We've been through so much this year, and it's normal to have this anxiety about reopening. For some, it just seems more uncertain than it did pre-pandemic, and it's particularly challenging for those who have lost a loved one. And what we know is that a third of all of us have lost at least one loved one throughout this pandemic. And also for those who have served on the front lines or experienced mental health symptoms during the pandemic. We need to take care of ourselves and be patient with those around us. We need to listen to ourselves and not judge ourselves too harshly. We may experience conflicting feelings, grief, anger, anxiety, and we'll know to acknowledge these feelings. The trauma won't disappear as the pandemic subsides, but there are things that you can do to help. You consider exercising, journaling, meditating, talking with friends, or engaging in a creative activity. We also have mental health resources at longbeach.gov/mental health matters. We often talk about the light at the end of the tunnel, and through all of this, I've been wondering how long is the tunnel and how bright is the light? It has been a long 14-month tunnel. It's been very long and exhausting. I now believe we can see the light at the tunnel, and the light is bright. And so with that, I say thank you, and I'll turn it back to the mayor.
Thank you, Kelly. We will now take questions from the media. As a reminder, there is time for one question each. Additional media questions can be sent to the Joint Information Center. First question comes from Julie with ABC 7. Julie, go ahead and unmute yourself and ask your question. Julie, do we have you on? Okay, moving on.
Maybe we'll go back to Julie, see if we can get her on the podium.
Moving on, next question comes from Haley with the Press Telegram. Haley, please go ahead and unmute yourself and ask your question.
Hi, my question is for Kelly. I know that the mayor shared earlier the percentage of people above age or 16 and older who have been vaccinated, and I'm wondering if that data exists for 12 to 15-year-olds and overall ages 12 and up, since that's the eligible population right now.
Yeah, so for our 12 to 15-year-olds, we've been seeing in the last 2 weeks, since it was opened through May 17th, we had about, I think it's approximately 400 of each age group of 12, 13, 14, and 15. We actually saw much larger numbers of some of our older youth, 16, 17, and 18. We were seeing closer to 1,000 of those in those age groups per age group. We don't currently have the 12 plus in terms of overall population. We're working to provide that information. So at this time, we don't, the census data for those populations, they're grouped, and they're not grouped in a way that gives you 12, but the state is working, the state has those data by county, and they are looking to identify it in a more city or other level.
Our next question comes from Kelly with the Long Beach Post. Kelly, go ahead and unmute yourself and ask your question.
Hi, this question is for the mayor. It's actually regarding the Queen Mary. This ship has been in the news this week regarding a recent report from the city that showed that the Queen Mary is in more serious condition than previously thought and will likely need at least another $23 million in critical repairs just to remain viable in the next 2 years. And Mayor, last year in your State of the City address in January, you said that the ship should be preserved as an important piece of history for Long Beach. So my question to you is that, do you feel that the city of Long Beach has properly overseen and protected the Queen Mary? And do you feel that the city should continue to work to preserve the Queen Mary in light of these recent reports?
Okay, I think the question was, the first question was, I'm sorry, Kelly, can you get the first part of the first question of the two questions?
Yes. Do you feel that the city has properly overseen and protected the Queen Mary in recent years? And do you feel that the city should work to preserve the Queen Mary in light of recent reports?
Okay, got it. So first, I still believe the Queen Mary should absolutely be preserved. I think it's an important part of not just like Long Beach history, but of the history of the country and its relationship with the UK. So from a preservation perspective, I think that's really, really important. And so that has to be still, there's obviously a very complex process right now with the bankruptcy, but that has got to, I think, be at the center of what happens in the future. So I'm still very much believe in that. I think the first part of your question is a good one. I think the city's been trying to get the Queen Mary right for 40 plus years. Certainly since it's been, from one leaseholder to the next. And I think that's been something that, for all of us that kind of want that preservation to happen, it's hard to see. I think there's been attempt after attempt after attempt, including currently, and it has not succeeded to the point where there has been the right partner and the right preservation plan in place. So we're going to, I think the city right now, during these proceedings, are going to continue to get through it. I think we're going to have the issue around the bankruptcy there's going to be some resolution to this, including some of the conversations and the study that's happening right now with the Harbor Department. So I think that a lot of that over the next few months, there will be a lot of hopeful resolution to what's next. Regardless of what that resolution is, my hope is at the end of that, there is a focus on preservation of the ship, and that becomes the center of what happens moving forward.
Our next question comes from Jason from the Long Beach Post. Jason, go ahead and unmute yourself and ask your question.
Hi, can you guys hear me? Hello?
Yes.
Okay.
Yes, we can. Go ahead.
This is okay, cool. This is a question for both the mayor and Kelly. You can go to sporting events now. Libraries in the cities just opened. I believe you, Mr. Mayor, went to Disneyland last week. Is there a medical reason for the city continuing to hold council meetings remotely, given the efficacy of vaccines and the large percentage of people already vaccinated in Long Beach? And when will the city announce that the city council meetings will resume in person with public in attendance? And what kind of modifications might that require?
I can go and then you can go. We've made the request already to go back to in-person. And I know that I've talked directly with Mr. Modica and the clerk, so they're actually working on that. I believe, and you can correct me if I'm wrong, Kelly, that there's a meet and confer process that is going on right now, and maybe I think if you sent that over to the city manager's office, you can probably answer that question. But I expect that the clerk, hopefully very soon, will be able to kind of announce that date. But we have already made the request to come in. We think that we are there. I think LA City Council is going back in person on June 15th, I think, is the date that we saw. So we'd like to be there as soon as possible. And right now it's a process of the clerk and the meet and confer process. But I'd have you confirm that with the city manager. I'm not sure if there's anything to add to that.
No, I think the June 15th is the focus for when things sort of go back to normal. So that would allow people to be in that space, more easily allow people gatherings and other right now in workspaces. We're still continuing to have people work from different places to provide that safety. June 15th is when those start to shift, which allows us into that space.
For our final question, we're going to circle back with Julie from ABC7. Julie, go ahead and unmute yourself and ask your question. All right, that concludes our questions for today. We will now move on to Spanish interpretation.
Muy buenas tardes, gracias por acompañarnos. Hoy es nuestro comunicado de prensa para el 20 de mayo del 2021. Hoy nos acompañó el alcalde García y la directora de Salud y Servicios Humanos de la ciudad, Kelly Colopy. Estamos esperando ansiosamente el 15 de junio cuando el estado reabra. Empecemos primero también con buenas noticias. Más del 50% de la población total aquí en la ciudad de Long Beach ha recibido al menos una dosis de la vacuna COVID-19. Este número aumenta al 98% cuando vemos el grupo de adultos mayores de 65 años y más, y 62% de los mayores de 16 años que han recibido por al menos una de las vacunas. Y nuestra meta ahorita es llegar al 70% que mencionó también el presidente Biden, que es lo que queremos en todo el país. a llegar por lo menos al 70% de nuestra población ser vacunada. Las vacunas apoyan nuestros esfuerzos colectivos para reducir la propagación de COVID-19 y proteger a nuestra comunidad. Actualmente tenemos a 16 residentes hospitalizados por COVID y hemos perdido a 935 residentes de la ciudad de Long Beach a causa de este virus. Queremos darle las gracias al Ayuntamiento de la ciudad, quien ha aprobado un memorial para aquellos que perdieron sus vidas durante esta pandemia. Más información sobre eso se verá en los próximos meses, también decidiendo en qué localidad estará ese memorial. Otra cosa que también mencionó el alcalde es que el Hospital Comunitario de Long Beach ya ha reabierto, que es una gran noticia. Tendrá también un cuarto de emergencia y el enfoque aquí ahorita de la ciudad es la infraestructura de salud en nuestra ciudad para poder crear algo grande y fuerte después de esta pandemia. Al final de todo esto, el Departamento de Salud va a agregar un total de 100 personal adicional para asistir en salud pública y también a aquellas personas sin hogar. Estamos también logrando un progreso sustancial en nuestro programa de distribución de vacunas con más de 330,000 dosis de vacunas que han sido administradas aquí en la ciudad. Las primeras citas de vacunación aumentaron más del doble la semana pasada en comparación con la semana anterior debido a dos factores. La primera, que los adolescentes de 12 a 15 años ahora pueden recibir su vacuna. Y también la segunda es que la ciudad ha creado un programa de incentivos de vacuna. Esos incentivos son para alentar a las personas a vacunarse y están demostrando ser tremendamente exitosos. La ciudad distribuyó aproximadamente 5,700 boletos para el acuario solo la semana pasada. Esta semana hasta el 22 de mayo, aquellos que reciban su primera dosis de vacuna de Pfizer o de Moderna de la vacuna o su única dosis de la vacuna Johnson & Johnson a través de cualquier centro de vacunación aquí administrado por la ciudad de Long Beach van a ingresar automáticamente para ganar el sorteo de oportunidades. Podrían ganar un Nintendo Switch o una estadía de 2 noches en un hotel local. Se sortearán dos nombres cada día. Continuamos explorando varias estrategias para animar a los residentes elegibles a protegerse a sí mismos y a sus seres queridos contra COVID-19. Vamos a estar anunciando más incentivos a medida que estén disponibles. Ahora vamos a hablar sobre las vacunas. Además del sitio de vacunación masiva en el Centro de Convenciones de Long Beach, las clínicas móviles de vacunas están ofreciendo vacunas en los parques locales 6 días a la semana. El vehículo móvil de vacunación de la ciudad continúa llegando a los residentes confinados en sus hogares. La vacunación móvil en campus selectos, incluida la preparatoria Cabrillo High School, los sábados se está fortaleciendo. Desde el 6 de mayo, cuando los adolescentes se volvieron elegibles para recibir su vacuna, hasta el 17 de mayo, el Departamento de Salud administró más de 3,600 dosis a las personas de entre 12 y 18 años aquí en Long Beach. Nuestro equipo de alcance del Departamento de Salud Multilingüe y las organizaciones comunitarias asociadas están haciendo un trabajo fenomenal llegando a las personas en los vecindarios más afectados por esta pandemia y más altas para promover esas clínicas móviles. Se han administrado miles de dosis a través de nuestros sitios de clínicas móviles y los aspectos más destacados incluyen más de 1,600 dosis en la preparatoria Cabrillo High School, 1,400 dosis en Houghton Park y 1,200 en MacArthur Park. Como recordatorio, las clínicas funcionan 2 días a la semana en 3 parques de la ciudad, que incluyen las siguientes: Admiral Kidd Park, los lunes de 3 a 5 y los jueves de 9 de la mañana a 11 de la mañana. El Parque MacArthur los martes de 3 a 5 de la tarde y los viernes de 9 a 11 de la mañana. Houghton Park los miércoles de 3 a 5 de la tarde y los sábados de 9 a 11 de la mañana. A través de nuestra asociación con el Distrito Escolar Unificado de Long Beach, además ofrecemos estas vacunas en Cabrillo High School los sábados de 10 de la mañana a 1 de la tarde. Y las vacunas ahora están disponibles también en la escuela primaria Grant, miércoles y viernes de 10:30 de la mañana a 12:30 del mediodía. Y Washington Middle School, martes y jueves a partir de las 2:30 de la tarde hasta las 4:30. Hoy, 20 de mayo, estarán ahí hasta las 2:30 de la tarde, que será la excepción. No se requiere ninguna cita y, como saben, las vacunas son dadas sin ningún cargo. También queremos mencionar que el próximo fin de semana de Memorial Day, lo importante que será recordarles de celebrar de manera segura para poder evitar cualquier tendencia del aumento de este virus, que es también muy importante. Otra cosa que mencionó el alcalde es que estamos también viendo poder ofrecer horarios nocturnos o en la tarde o en la noche para poder vacunar a aquellas personas que trabajan durante el día. Les pedimos que continúen practicando todos los protocolos de salud y seguridad, pasar tiempo al aire libre, alejados físicamente de otros grupos y también cubriéndose la cara. Ahora voy a hablar sobre las mascarillas o cubiertas faciales que han sido un punto de confusión ahora que el CDC salió con algunas nuevas noticias. Así como también puede causar un poco de ansiedad para muchas personas. Aunque los CDC anunciaron recientemente cambios con la guía de mascarillas para personas completamente vacunadas, los protocolos estatales actuales del Departamento de Salud Pública aquí del Estado de California continúan recomendando que se deben usar las cubiertas faciales bien ajustadas en lugares públicos, interiores o exteriores llenos, independientemente del estado de vacunación. Hasta que cambie esa orden de salud del estado, la orden de salud de la ciudad de Long Beach permanecerá en lugar. Como recordatorio, nuestro orden de salud está disponible en el sitio web de la ciudad, longbeach.gov/COVID-19, que es COVID-19. Cuando use una cubierta facial, protégese a los demás y también a usted mismo. Los cubrimientos faciales, así como el distanciamiento físico, son una de las formas más efectivas para poder protegerse a usted y a sus seres queridos de COVID-19. Como se les recuerda, COVID-19 se transmite principalmente de persona a persona a través de gotitas respiratorias. Estas gotas viajan por el aire cuando tose, estornuda, habla, grita o también cante. Estas gotas pueden caer en la boca o en la nariz de la persona que están cerca de usted o pueden ser inhalar hasta esas gotas usted mismo. Los datos de estudios publicados muestran que el uso de mascarillas o esas máscaras reducen esas infecciones. Las máscaras reducen el intercambio de gotitas cargadas de virus, lo que sigue siendo importante para las personas cuyos síntomas aún no han aparecido o que son asintomáticos, que no muestran ningún síntoma, ya que se sienten ellos bien y no saben que ellos pueden estar propagando el virus a los demás. Las máscaras también pueden proteger al usuario, ya que impiden que las gotas lleguen a usted. En la actualidad, todas las personas todavía deben de cubrirse la cara en los grandes eventos, el transporte público, las tiendas y los establecimientos comerciales. Cal OSHA continúa exigiéndolo para lugares de trabajo, además de los requisitos de distanciamiento. También se sigue requiriendo máscaras para todas las personas no vacunadas al aire libre en cualquier momento en que no se pueda mantener ese distanciamiento físico requerido. No se requieren mascarillas para personas completamente vacunados en los siguientes lugares. Primero, al aire libre, a menos que asista a eventos llenos de gente, una multitud. Segundo, visitas interiores y exteriores en entornos privados con otras personas que también son vacunadas, como pequeñas reuniones con sus familiares. Si son todos vacunados, estaría bien removerse esa máscara. Y visitas en interiores y exteriores con personas no vacunadas de un solo hogar y que también tienen un riesgo bajo de contraer la enfermedad grave de COVID-19. Anticipamos que el 15 de junio las personas completamente vacunadas ya no vayan a necesitar usar la máscara o distanciamiento físico en la mayoría de los ambientes interiores, excepto cuando lo requiera esa empresa y la guía del lugar de trabajo. Esto no se aplica a los entornos de atención médica y algunos otros entornos de congregación. Entonces recuerde que van a tener que respetar las empresas locales que sí requieren que todavía la usen. Aunque estamos a menos de un mes del 15 de junio, es importante que mantengamos en rumbo y en orden todos estos requerimientos. Cumplir con las pautas de mascarillas actuales mantienen todos a salvos y continúa también reduciendo los números de infección. Para muchos, la reapertura y relajamiento de los protocolos es bienvenida y se están apresurando a volver a participar en la vida como era antes de esta pandemia, pero para otros existe ansiedad por estar en público y entre multitudes. Una encuesta de febrero de este año de la Asociación Estadounidense de Psicología encontró que en general los estadounidenses dudan sobre el futuro. Casi el 50% de la encuesta dijeron que se sienten incómodos al adaptarse a la interacción en persona en vez ya que se finalice esta pandemia. Y los adultos que reciben una vacuna a COVID-19 tenían la misma respuesta. Entonces, no importaba si tenían la vacuna o no, casi el 49%, casi la mitad de las personas que tomaron esta encuesta no se sienten cómodos de estar cerca de otras personas y también poquita de ansiedad. La ansiedad de reapertura se manifiesta de manera diferente para diferentes personas, pero puede parecer estrés por la incertidumbre del futuro, miedo sobre cómo adaptarse a nuevos cambios, cómo estar expuesto a situaciones en las que podría sentirse inseguro o resistencia a participar en situaciones o actividades prepandémicas porque ha encontrado más seguridad o comodidad en su vida encerrada. Algunas de las opciones menos saludables para hacer frente a una pandemia incluyen comer más, beber más. Se ha visto un aumento bastante de la venta de alcohol y también hacer menos ejercicio, no crear un buen horario. Mucha gente ha tenido dificultades en dormir y pensar demasiado y temer lo desconocido. Hemos pasado por muchas cosas el año pasado. Es normal sentir ansiedad por esta reapertura. Necesitamos cuidarnos y ser pacientes con quienes nos rodean. Tendremos que escuchar a nosotros mismos y no juzgar con demasiada dureza, ya que hay personas van a tomar esto un poquito más, la reapertura un poquito diferente, unos muy contentos y otros un poquito de resistente. Es posible que experimentemos sentimientos contrarios y tendremos que reconocer esos sentimientos. El trauma no va a desaparecer cuando esta pandemia desaparezca, pero hay cosas que usted puede hacer para obtener ayuda. También recomendamos que considere hacer ejercicio, escribir en un diario, meditar, hablar con amigos o familiares o participar en una actividad creativa. También les recomiendo que visite recursos de salud mental disponibles en longbeach.gov/mental health matters, deletreado MENTALHEALTHMATTERS. Muchas gracias por acompañarnos. Eso va a ser todo por hoy. That is all for today. We thank you for joining us. If you have tuned in during our Spanish translation, we recommend that you visit the City of Long Beach Facebook page to see this press briefing from the beginning with Mayor Garcia and the Director of Human and Health Services, Kelly Colopy. Thanks again for joining us.